You'll have your work family, and you're going to have your family, and you should like both, because there's nothing worse than getting up in the morning and having to go to work to be amongst a bunch of people you don't like. In the past, we would have cavities that kind of, if the decay would start, it kind of widened up as it went down. Now, when we do have decay, the enamel is so hard from the fluoridation that if there's one little niche, one enamel rod for them to go down, they can get actually down into the tooth and it kind of explodes inside. Because the cavity isn't from the sugar. The cavity is from the bacteria in your mouth that feed on the sugar. And then the byproduct is acid. They secrete acid as a byproduct of consuming that sugar. That acid is what breaks down the tooth structure. I would say about 20% of our smile makeovers, I'm remaking other dentists' attempt to do a smile makeover.
Wow.
Dental insurance is only out there to exist to make money. And so if they know this other thing, which is great treatment and beneficial, but they're going to lose money on it, then they just don't cover it. When I started doing Botox, I learned people had a hair budget at the time. And I said, well, you just need to figure out your Botox budget. How often do you want to come in? Then you just budget for that. Only 50% of the population even goes to the dentist, because the other half are too busy or scared.
Doc, welcome. You're actually my dentist.
I am.
So you being here means a lot to me. You've been in the industry for 20 years.
In a row.
In a row. That's awesome. Well, thanks for coming on. I appreciate it.
You're welcome.
Cool. So the first question I want to start out with right off the bat is, what's it like being a dentist? It doesn't have to be a long answer. I'm just curious, as a non-dentist, how would you describe what's it like being a dentist?
Well, I can only speak from my way of being a dentist, because nowadays there's different versions of dentistry. There's the corporate type, where the McDentist office. I don't have experience with that to really speak of that. A typical day for me is we have a schedule where there would be one column where people are getting their teeth cleaned, and so I would manage a hygienist who does the cleanings. I would come in to do an exam and find out if there's any work that needs to be done or had been treatment planned to do. My column, or two columns depending on the schedule, is a mixture of fixing teeth and many other. We have a variety of services that we offer that many dental offices don't. A typical dentist would probably be doing fillings and crowns and restorative type things. Typically, it's an 8-hour day. In our office, we go a little bit longer, so we have a little bit fewer days but longer hours to average out to some of a normal week. In our office, every day is different. So it's a constantly changing in job, not environment, you're in the same office. Yeah. But it's a changing... Because we have a mixture of services, every day could be different. If you have fewer services to offer, every day is going to be fairly the same, pretty similar. Got it. Cool. So let's go back to the beginning, or whenever being a dentist entered your head. All right. The earliest, I'm trying to, throughout the interviews I've conducted with people, it's amazing to see how young... I think the youngest was 7. Someone who was like in his 50s doing something said, since I was 7, I wanted to do something. Wow. Okay. When did I want to be a dentist ever enter your head? It probably entered my head in college. A girl that I was dating, or just really close friends with, she was going to be a hygienist. Her dad was a dentist. And so I kind of got aware of what things were. I'd always had my teeth cleaned growing up. So I knew dentistry existed. I was always interested in the health industry. I think at the time I was considering going into being a physician until I learned what their hours were like. And I thought, I don't need back in the day, I didn't want to be married to a pager. I don't know if people nowadays even know what a pager is, but being on call and those types of things. So I learned about it early in college. And then after a couple years of college, I had a summer job. And I was looking for work during the summer and answered an ad in the paper back when there was paper, there was an ad for a delivery boy to deliver retainers for an orthodontic lab to go to orthodontists.
Oh.
So I think I was 22 at the time that I started looking around. I noticed, I looked at the lifestyle of it, and that is what kind of appealed to me initially. Because every time I delivered on a Friday, there was nobody around. And typically a dentist and orthodontist don't work Fridays.
And you like the fact that they're home while you're working.
Yeah, I thought, okay, this is cool. And the other thing I noticed is most of them didn't seem too stressed out. They seemed to all enjoy it. Now, I was talking mostly to orthodontists. I think there's a little bit more stress in the general dentist area. But they all seemed to like their job and encouraged me to look into it further. And I had the grades at the time, and I thought, well, let me change my major or direction of focus of studies towards that, and just never look back.
Wow. So you fell into it. Well, it sounds like, obviously you had to have some interest in teeth and those things, but you weren't a kid who grew up and said, I want to fix people's teeth.
I wasn't. I wanted to be in the health industry. And when I had this job, knowing that I could work 4 days instead of 5 or more, that I wanted to look into this a little bit more. I always thought it was an absolutely disgusting profession, all the spit and blood and everything. But then when I noticed that in the 80s with the AIDS scare is when they started wearing gloves. Mm-hmm. And so with universal precautions and barriers that we use, I no longer felt like I wasn't actually touching gums and blood and things like that. I think if I had to do barehanded dentistry the way it was 30 years ago, I wouldn't have even looked into the...
Interesting.
Yeah.
So it's more sanitary. So what's next? You want to become a dentist. Mm-hmm. What do? You just change majors?
Dentistry, to get into dental school, medical school and dental school essentially are the same thing for the first 2 years. Okay. And then the next 2 years, they kind of branch off. So there are some dental schools where the freshmen take their science classes with the medical students. So there's an overlap mixture like that. The school I went to, it was separate. But dental school in America is something that is a after college type of a program, whereas other countries, you right out of high school, you take maybe a 5-year program, but you're starting dental school right out of high school. So here in America, usually you're going to have a 4-year degree first to go to a college. You have to take certain classes to satisfy what they call prerequisites. There are some required courses. So you need a year of inorganic chemistry, a year of organic chemistry, a year of physics, some English, to make sure you can write your chart notes.
Wow.
And then a few other things that you could get done in just a couple years. So in some dental schools don't require an actual degree to get in. I actually got in without a degree after 3 years of college. But that meant we had to have a higher test score. If you have two applicants for the program and one has a degree and one doesn't, if everything else is equal, you'll take the guy with the degree.
Right.
So it's a little bit safer to get the degree before you go in. But if your test scores are high enough and your grades are good enough, you might be a better candidate than the guy with the degree, then the applicants they'll take you.
Interesting.
So dental school itself is about 4 years. And then after that, unlike medicine, there is no residency, there is no internships and things like that. Right after dental school, you have a license or you have a diploma. You could be a dentist immediately in private practice.
The next day.
The very next day after graduation, which is essentially what I had done. There are some advanced programs, we call general practice residencies, that people could explore, and it's 1 year of usually hospital-based, where you get a chance to kind of cut your teeth on being a dentist before you go out in the real world. And there's some pros and cons to that.
Interesting. So from the day so 4 years of college, and then how many years do you spend between the end of college to the day you could become to graduation?
Typically, it's 4 years. There is one dental school that's a 3-year program, but there's no summer break, so it's just compressed.
So it's a total of 8 years.
8 years.
Wow! And then you graduate. Mm-hmm. And do dentists typically take a big fat break and go travel, or do they jump right into? How does that?
We can't afford that.
You're dead broke.
So nowadays, what's probably most overlooked is most dentists right now are graduating with about $500,000 school debt. So $500,000 of debt doesn't allow you really to go out and take a summer off. You kind of got to start paying that note.
$500,000.
Yeah, and that's just the students. Now, if you go out and you buy a dental practice, most of those are going for $500,000. So you're $1 million in debt, haven't even seen your first patient. you better get going.
$1 million in the hole without a first patient.
Yeah.
That is crazy. Oh, do you think that's okay, $1 million in debt? You think it's
no.
that?
And that's why I think if people now... See, we played with different rules when I went to school. The debt was real. It wasn't quite that large. It wasn't zero, but... and I hear stories of way back in the 70s that the interest rates were such that dentists were taking out student loans just to buy a car or something because they could.
Wow.
The interest rates were great. It's a totally different game nowadays.
Wow.
There are ways to get scholarships. So if you could find a way to graduate from dental school without debt, because people right now, the industry, the insurance industry and healthcare is going through so much reform. There's a lot of encouragement for discounted services, donated services. With $500,000 or $1 million debt, we can't afford to give it away. Whereas if we would have graduated with no debt, we could be a little bit more generous. And so there are, like if a dentist got a military scholarship, what they'll do is they'll pay, usually you have to pay your freshman year is going to be yours no matter what. But if you can get a scholarship for the other 3 years, you really only have 25% of that student debt. So instead of $500,000, maybe it's only $100,000, $150,000. The rest of it is picked up by the military. Now, of course, you'll have to then give the military some time. So usually it's 3 to 4 years afterwards. You're going to be a military dentist on base wherever that is.
Wow.
Sometimes it's exotic. It might be in Europe. Sometimes it's in Peoria, Illinois. I mean, I don't know. Maybe
right.
Somewhere.
It could be anywhere.
It could be anywhere. Which isn't all bad because the military does a really good job of trying to make sure their dentists are doing a decent job.
Huh.
The pay is going to be a little bit less, but the benefit is you have no debt.
Wow.
So if you could get a scholarship that way or in any way, I think that would be a good way to go.
Interesting. So, well, it sounds whether you started in the 70s or in 2018, you're dead broke when you graduate.
Yeah.
And you need to get started. Before we get to how you got started, are there multiple career paths for someone who's gone through dental school, or is the only thing they could do with that schooling is being a dentist?
Yeah, unlike medicine has a lot more branches and opportunities of things to do. Pretty much, if you've got dental training, you're either going to be a dentist or you're going to be a dental educator. You can teach at the dental school, or you could sell products for a dental supply company, but to pay off that $1 million debt, you're probably going to be a dentist.
Interesting. So if you go through school and at the 8th year you go, I don't think I want to do it, you're done.
That's probably not the right time to make that decision.
I get the point.
I did know a guy, he was a year ahead of me. After 2 years, he figured out that he had no interest and he dropped out of dental school.
After 2 years?
After 2 years. So that's still a large debt. So you really want to do some soul searching before you start, because the commitment, once you're in, it's like the Hotel California. Once you're in, you'll never leave.
That's awesome. So I like that you mentioned soul searching, because I think that is a big part of why I created this space to sit with people, to provide people with that very information who are maybe looking to make decisions.
Yeah.
How do you know that when you were making a decision, is it just you wake up one morning and you say, okay, I know it's in my blood, I'm going to do it, I'm going to move forward with it? How do you, or do you never know? Do you just kind of jump in the water?
I think you never know. I do some soul searching every morning. And when the alarm goes off, you're like, why am I doing this? Was this maybe this is a bad idea.
I love it.
I don't, part of it you have to just kind of go, you can't steer a parked car. And so I chose my major to see how it was, figuring I'd learn along the way. Before dental school started, I would figure out if that really was what I wanted. And I thought I did, and I think I did enough searching to figure out that this was the right path for me. There are days where I question it.
And you still, and that's awesome to know, because if you really never know, then it might put someone at ease. Because
there are days where I really enjoy parts of dentistry more than other parts. And there are days where I'm like, man, this was a good day. I did good. I helped someone. And there are other days you're like, I could be a travel agent. Let's go see the world. Let's do something else. Hopefully there are more good days than bad.
As with any job.
Yeah, exactly. And I was talking to someone else about that, saying, the grass is always greener, because there was a question that was posed saying, if you weren't being a dentist, what would you do? And we finally came down to the conclusion that No matter what you're doing, it'll be the grass is greener somewhere else.
And what did you say you do?
Oh, I said any other option just wouldn't pay me enough to. Cause I have 3 daughters. I got a mortgage, and things that those types of decisions really need to be when you're single and 20 years old.
Right, not after dental school.
So I like to do a lot of what I do. Like I do a lot of dental photography because I do a lot of cosmetics, and I'd love to be a photographer or a travel blogger or something like that. But in order to make a living doing that, it takes, there's some lean years first.
Money doesn't grow on trees. You didn't have it come in.
Yeah.
Interesting. So let's go back. You graduate, and then you said you started the next day, or?
So in dentistry, we have an opportunity. I can either start from scratch, make a building and hang a shingle or a sign saying I'm open for business. Well, there's no patients, there's no cash flow. And if you're $1 million in debt, that's not a good idea.
Right.
What you could do is you buy an existing practice. A retiring dentist now no longer needs this practice he's built. And so then you can purchase that practice from them.
And his clients.
Right. So the charts are there. They're already coming to that location. Sometimes there's a transition time. So the two of you are working together for a period of time, and then he just completely goes away.
Gotcha.
Or there are some stories I've heard. When I purchased my practice, it was a retiring dentist who we worked together for about 6 months, and then he just stayed home. There are stories of people where they got the keys on Friday, and so Monday morning he introduced himself to the new staff and then everybody. I see there's some pros and cons to that because there's always this risk if a staff has a new dentist that they didn't interview with and didn't choose to work for, well, then they would quit. And there are stories of people the entire group just up and leaving. And then now you got this $1 million in debt. Now you also have to find people to answer the phones for you.
And you have a practice that has no people to run it.
If there's no one to run, there are temp agencies, but if they aren't familiar with it, it is a mess.
It's a mess. So when you were starting out after graduation, is that what you did?
Yeah, I bought a practice. I started having kids at the end of dental school. So $1 million in debt and 2 kids and a wife who's a great mother who's busy at the home. I had a little bit of pressure to bring home the bacon.
Interesting.
So I bought this practice and kind of transformed it into my vision of what a dental practice was. Because if you haven't been to many different dentists, you may not know that every practice is done just slightly differently, whether it be the paint on the walls or the demeanor of the office environment or the types of services that are offered. So it's always an evolution.
Interesting. So as you got into this business becoming this person who's buying dental practices, and that's not working with teeth, that's buying a business. Did you find that in dental school they didn't teach you enough about buying and running a business, or did they?
They taught us zero about running a business. So we graduate. So I would encourage anybody that was considering going into dentistry to, like when I was taking the courses on organic chemistry and inorganic chemistry, get some exposure, if not a minor, in business. Learn how to run a business because there's certain business principles that might seem like common sense that aren't that common. And I think you avoid a lot of heartache and frustration if you had some sort of training.
So you found yourself as a dentist who knows how to work with teeth, looking to buy a business, and you didn't know, so you just figure it out? So
there was usually there's what's called a practice broker. It's like buying a home, there's a real estate agent. They're going to guide you on things. Now, they'll provide a prospectus, a business plan, here's what the numbers mean. This practice is generating this much per month. This is how much their overhead is per month. And so you can just take it on faith that those numbers are correct, or you can hire someone to then evaluate those numbers for you to make sure that it's all on the up and up. And usually if there's enough eyes on it, there's going to be an eventual agreement on the value of the practice and things like that. So it doesn't tell you how to run the practice, just that the value of the practice might be correct.
Got it. So here's something I was curious about, and I'm curious about this with every job out there because I think to some degree it's true, but I'm curious how much it is in dentistry. So with what I do, I know that when I was going through training, there's what we call training world, and then there's the real world. Meaning there's like fantasy land, and when they train you in the classroom, it's because it's a controlled environment. So they could say this happens, and you do that happens. How different is training world from real world when it comes to the dentistry?
It's funny you put it that way, because shortly before graduating from dental school is when I decided I don't want to be a dentist. This was a bad idea, but it was too late and I was already in. So when I graduated,
year 7.
Yeah.
Okay.
6 or 7. Already married and kid was on the way, and I'm like, oh, what a bad mistake this was. But I had to finish, because I got in with dental school without a degree or anything to fall back on. So I had to finish. And so we immediately, within the first 6 months, we hired a planner. So someone coached me, what can I do to get my debts paid off and work to pay everything off but get out of dentistry. And what we learned was we came up with a plan, but I didn't have the skill set as a new grad to actually perform the dentistry in such a manner to actually generate enough money to do any of that. And so I had to pay more money to learn more skills, how to do...
how to pay off the debt.
Yeah. So to do like cosmetic dentistry. I do a fair amount of like smile makeovers, porcelain veneers.
And I want to talk about that in a little bit.
And so after I did a couple courses, what I learned was that was fun. I liked that. And so eventually, it didn't take long before I figured out that dental school and dentistry aren't the same thing. And I didn't like dental school, but I like dentistry as long as it's the types of services that I enjoy doing. So there are certain services that we have specialists for, and I can refer that stuff to them. And the other stuff that I do enjoy doing, I can keep for myself and do.
But as with training, with any job, obviously the things you learned about teeth and training, you really don't learn until you're out there in the field doing it.
And what's interesting is technology is amazing, and the dental materials that we have available today are so much different than we had years ago, even 5 years ago. And the dental schools still are bound to the basics. And so pretty much on a day-to-day, there isn't anything I do on a day-to-day basis that I was taught in dental school.
Wow.
Materials are totally different. Because the materials, the method to use them is different than the method to use an old material. And so there are some fundamentals that I had to be taught. And the reason they do that is the dental schools are designed to teach you enough to pass the board exam. You have to have a live patient and perform dentistry, and then someone evaluates you. And if you didn't do it right, you don't get a license.
Wow.
So,
and who are these live patients? Do they get paid?
It's up to you to make arrangements with them. So I had to pay my patients, the free dentistry itself.
Absolutely.
And then because there are stories of a patient, because many things are 2 visits. We had to do it's called a gold inlay.
Okay.
And it's like a golden filling, but you have to take an impression and have a lab fabricate it. And then the next appointment, you bond it or cement it in place. And there are stories of people knowing the position they've got this person in, saying, I'm not coming back unless you pay me X number of dollars.
Wow.
So it didn't happen to me, but I'd heard stories. But usually what you're using are people from the patient pool of the dental school. Well, dental schools typically are using maybe disadvantaged people, lower income people that are coming in for the discounted dentistry. Yeah. These people can be somewhat less reliable, depending on who you chose as a patient. Right. So it comes down to patient selection. If there's not, I had one of my friends actually sent a car to pick up his patient to make sure they showed up on time, because it's got to also be on time. There's no, I'm 20 minutes late. No, the board exam starts right now, and we have a protocol. It's a very stressful weekend.
Interesting, but it's a real person.
It's a real person.
And you can't beat that when it comes to.
And, well, there's certain procedures. So usually you have 3 or 4 patients. So like for periodontal disease, we have to treat that. Well, that would be one person. It's a gold. You found a golden ticket if you have one person that's all the different services that needs to be done all in one.
So you're looking for someone with the worst teeth.
Well, it can't be too bad, because if it's too heroic, it's hard for the examiners to know was this done ideally.
Got it.
So it's got to be kind of just in the threshold of we got to treat this.
Wow.
As opposed to, because sometimes some dentistry, some lesions are so small that it's kind of a gray area. Should we wait and watch, see how this goes, or should we go ahead and treat? And you want the one let's go ahead and treat.
Got it. So there's a line somewhere.
Yeah.
Interesting. So during training or in dental school, did you find, or today looking back, 20 years later, are there procedures or is there anything within your day-to-day job that during dental school intimidated you? Maybe it appeared to be like, holy cow, I'll never get this down. And today, looking back, it's one of the easiest things you do in your office. Or was everything just a big intimidation and you get better as you go?
Pretty much everything was pretty intimidating to begin with. My school did a pretty good job. We practice on models in a lab before we see live patients. So we kind of work out some of the confusion. Because it certainly is a lot easier to be on a lab bench and drilling on a tooth, and then suddenly now you're downstairs in the clinic, and it's upside down and it's in somebody's head, and you have to get the cheeks out of the way. It's a different environment. So you kind of worked out what you're supposed to do to be able to now handle all the curveballs they throw at you. The person who tends to gag and they salivate a lot and they fidget a lot, and it's a moving target. It's all intimidating at first. I can't think of anything. Some of the surgeries, I really didn't. I didn't know how to do stitches very well in dental school at first. So that was intimidating to me when you had to open up the tissues and really get in there and remove something, and then sew it back together. And for years, actually, I wouldn't do anything that involved any suturing at all. If it was going to involve suturing, it was just an automatic referral. And then I watched a friend of mine. I was hanging out with him, and he said, so I watched him do something, and he was using these different instruments to do the suturing. I said, what was that? And he goes, oh, this is a needle holder. I'm like, that's not what we used in school. He goes, oh yeah, I would never use that. What I found was if you have the right tools, a lot of things are much more simplified. And so then once I learned how to sew, suddenly it opened up the world of different procedures that were very intimidating to me. And this is after dental. This is like 10 years ago.
Wow.
And once I knew how to put things back together, then I wasn't afraid to disassemble things. Because sometimes we call if you're extracting a tooth, we have simple extractions and surgical extractions. Okay. Simple ones, it kind of comes out predictably. The surgical ones, there's a lot of digging, and it can be very bloody. Every extraction is simple until it isn't. And so if that's the case, if there's a chance it might go surgical, that was always a referral then. Now, because I know how to reassemble things and be able to graft things and manage post-operative discomfort and things like that, suddenly there were fewer things to need to refer out.
Interesting.
So I think like with any skill, initially it's a challenge. It seems impossible, and then after practice, you get better at it. You may still choose that it's not something you enjoy doing and refer anyway.
Right.
But knowing how to do it.
So I like that you mentioned the term refer out, and I'm sure every dentist, anyone at some point, it exceeds their area, and they refer out to other people. Is the goal of every dentist to reach a point where they don't refer anything out, or is referring out part of what makes the industry great? It's
a mixture of both. I think if you're a dentist who really enjoys a variety, then the goal would be to refer less. I don't think you could ever get to a point where you don't refer anything whatsoever.
Right.
There's also the economics of it. With the business aspect, $1 million in debt, you then have to look at the profitability of a procedure. I might have a procedure that is going to take an hour of my time, but it's only going to generate $200. And something else that's going to generate $2,000 for the same amount of time. Well, if I have enough of these other higher producing procedures to do, and it's all about, do I have the time for it? If there's just so much of that I can't get around to this other one, it might be better off to refer this lower producing thing, let someone else handle that so I can do the other part that's going to generate a little bit more money.
And that goes into the whole business and number side of things.
Which is a challenge when you're in a healthcare environment. Am I treating this person to treat them, or am I looking at them just as the money? And the money that you generate.
What's that line? How do you find
terrible.
The line?
It's the part that I struggle with the most, because I always want to think of the patient first. And is it better to make less for this one procedure because of the situation. And I will always choose in the best interest of the patient. So if mobility is an issue, and then we've got them in the chair right now, and we've got the time to treat them and take care of them right now, even though it's not that profitable, we might just break even on this person because it's the best thing for them. Having said that, sometimes this procedure, yes, I could do it. I probably won't. Sometimes I'll tell patients, in an effort to stay friends,
right,
I need to make this referral because he's going to do it much more atraumatically. It's not going to hurt if he does it. You'll probably hurt if I do. So even though I'd like the money, I think you're going to hurt less if he does it.
Got it. And so it sounds like there's a bunch of lines that as time goes on, you need to figure out, and you do your best judgment.
Yeah,
I guess.
We do have classes in ethics in dental school. So, we try to make sure everything we do has an ethical aspect to it.
That's awesome. Here's something I'm curious about. Is anything and everything reversible and fixable, or no?
Probably nothing's reversible.
Okay, that's right. They're very different things.
Yeah.
Okay, so fixable.
Everything's fixable. So the question becomes, what would it take to fix? Was it a fairly minor procedure that now is going to take a major procedure to fix it? Probably the only thing that probably could be considered reversible would be braces. We could orthodontically move the teeth, and if you didn't like it, we could move them back. But truthfully, we would just leave them where they were if you didn't like them, or someone else could take over the case and do it differently to get the desired result. But as soon as I cut on a tooth, that tooth will always be cut, and I can fill that space. If it didn't fill well enough, we could always take that part out and refill it. There's a finite number of times I can touch a tooth before the nerve gets angry and it would need a root canal and things like that. So we can't just be working on a tooth over and over and over again. Eventually something else would be necessary. But there's everything is repairable in some fashion. It may not go right back to the way it was before,
right,
but it will be an acceptable outcome.
So running a practice for 20 years, what are some things that you learned about the industry, about teeth, about people, about running a practice? What are some things that you can only know 20 years in, that there's no way going through dental school you'd ever guess?
I think probably all of it. I'm trying to think. Probably the hardest part of being a dentist is the practice management, the staff issues, the dealing with people, because you hope that they care as much as you do about the patients and about the practice and things like that. This is probably not politically correct, but having an office with predominantly women.
This is not a politically correct show,
good,
so
good.
You can knock yourself out.
A room full of women and depending on, my practice is on purpose somewhat smaller. Having 4 personalities to manage is way easier than 40. What tends to happen when you have a larger practice, larger amount of people, is people start to subgroup. They have their little cliques. It's like high school all over again. And this group talks and this group talks. And I didn't realize, probably as a teenager or in my early 20s, that those personality traits would continue forever. And having a smaller group makes it a lot easier. It's a harder thing to do, to find the right mix of people that would get along. You don't have to be best friends when you go to work,
right,
but it should be. My daughters are now in college, and so they're looking at their future and things, and I have to keep having to explain to them that you'll have your work family, and you're going to have your family, and you should like both. Because there's nothing worse than getting up in the morning and having to go to work to be amongst a bunch of people you don't like.
Absolutely.
So life happens. What's frustrating is you finally get that perfect group, and you're excited every morning when the alarm goes off because you like your group. And then someone's husband gets a job transfer and they got to go. And then someone else gets married and wants to be home and have kids. And so suddenly it's going to be a constant turnover. It may not be as frequent. Sometimes it might be every 5 years you have to turn over, and sometimes it might be frequently, every couple months. And it's just a constant. It's like spinning plates.
So it sounds like the most challenging part of your job as a dentist has nothing to do with teeth.
Nothing to do with teeth.
That is fascinating.
The easiest part of my job is the teeth. Yeah.
That is fascinating. Wow. Does every dentist have to own a practice?
No. No. And I think there are some dentists, many dentists probably shouldn't own a practice. It takes a certain personality to handle all that. There's a fair amount of stress and anxiety involved just running any business, let alone a dental practice. So there are, in the past 20 years, there's been a rise in what we call corporate dentistry.
Okay.
There's the McDentist type of chain. And it's where you'll see the same name of an office down the street 20 miles from each other and big neon signs. And they're designed a little bit differently than the independent practice. They're designed a little bit more for volume, so you're going to have more people. They're usually going to have more than one doctor in the office running it. They may mix and match and move around a little bit, but those would be the associate or the employee dentists. And so there's some pluses and minuses to that. My brother is a dentist as well.
Oh,
and he was a practice owner for about 5 years, and for the past several years he's been an employee dentist because followed his wife. Went into medical school and then was in a residency and things like that. So he had to move. Needed the flexibility of because as soon as you're a practice owner, you've got roots. You're stuck. There's nowhere to go. If you're an employee, you do have the option to give 30 days notice and move on to some other location.
Like a nurse, traveling nurse.
Exactly, those types of things. So he needed that flexibility.
Is the money could it be the same in terms, meaning you might make more with a practice, but you're spending more?
It could. And that's one of the hardest things is when you see these articles talk about national averages and you're like, what? Where's that at? Because I want to move there.
Interesting.
In theory, I don't think necessarily the money is better, because you can have people that as an associate makes more money than me as a practice owner. And you have many other associates making next to nothing. So even practice owners, some practice owners are doing very, very well, and some other practice owners are living month to month. So it's all over the board as far as when the compensation goes. There are some advantages of being a practice owner when it comes to accountants and tax planning and things that you get to use from that perspective. But a lot of dentists have no interest in these other advantages. And just enjoy the ability to go home and make a good living and without the other stress.
So back to what we said, meaning where once you complete dental school, you're pretty much a dentist. But once you're a dentist, it sounds like there's different, not many, but different ways you could go about it.
Pretty much. There are some dentists that don't do any dentistry at all. They buy a practice and they build it up, and then they bring in an associate to run it while they manage it, and they buy another practice. So
it's like flipping homes.
No, they'll still own it.
Got it.
So they'll own, and a lot of these guys, this is one reason why corporate dentistry has picked up. The venture capitalists have come in, and if you own more than one dental practice, you can sell to these guys for what looks like a tremendous amount of money, and I'm kind of jealous of these guys doing it this way. But there are dentists that do very, very well and haven't touched a tooth in 15 years.
Wow.
Because they're really just business managers and businessmen. So in my mind, they have a dental license, but they're not really dentists.
Wow. That's interesting. Let's switch gears and talk about something you're actually probably the most known for or very known for, and that's cosmetic dentistry.
Yeah.
Or beauty dentistry.
Yeah.
So many people come to you to not repair or fix their teeth, but make it look good.
Yeah. Sometimes there's nothing wrong. Many times we'll do a smile makeover, we're fixing things. There are things wrong. We're like, if we just do a couple more teeth, it allows us to make it look amazing.
So let me start the topic off with a question. That does the body or the mouth care whether the teeth look good, or does all it care about is whether or not they're healthy? Does good looking teeth add anything to my teeth's strength or anything? Longevity?
The look of it, probably not. No. The beauty is in the eye of the beholder.
Right.
That kind of a thing. Having said that, many times doing good I have a lot of patients come to me just because they want their teeth cleaned, but they want someone who does cosmetic dentistry because they figure that we've been trained to maintain things better. And to a certain degree, that's true. To keep the shine or the luster of the porcelain veneer takes a certain technique to polish that getting your teeth cleaned at a regular office they might actually dull it and make it less shiny because they're not really aware of things like that. Right. In a way, orthodontics. Many times when we do braces, the side effect is a beautiful arrangement. It's pleasing to us when we look at it, but it's actually easier to maintain. So crooked teeth are harder to floss. Oh. They're harder to brush because there's an overlap or whatever. If we can line them up, we can maintain a lot better. So in that regard, yeah, health is improved because of the cosmetic aspect. But if a tooth is broken, I can fill that space with a really ugly material and it works just fine. Huh. But it's ugly and you probably won't want to smile amongst your friends. So we don't do it that way, but I could.
Interesting. So you initially got into this whole area of dentistry because back to,
because I want to get out of it.
You want to get out of it. So you're looking for different, So did you just fall in love with it? Or is the money so great there?
Part of it, the money isn't good enough to deal with some of the things we have to deal with. So the reason I say that, well, I've had patients come from all over the world.
Because you're that good at it.
Yeah, I mean...
You don't have to be humble on the show.
Okay. No one's watching, right? Okay, good. Yeah, I had a lady, a beauty pageant contestant from Belgium, come all the way out. This was about 10 years ago. We've become really good friends, and I've treated some of her friends and family as well. They've flown out. I had an actress from LA come up, and she was recently in Jason Statham had a movie called The Meg recently. So the Sci-Fi Channel had, their Sharknado version called The Megalodon or something like that. Right. So she was a bit actress in that. So it was kind of fun to watch. Hey, there she is.
That's awesome.
I had a dress designer from Orange County come up. So they'll come from all over, but most of my patients are local. I got into those types of people, especially beauty pageant contestants, are the nice way to put it is fastidious. They're very, very particular.
Interesting.
And so our protocols, the way we do things, I can handle particular just fine.
Right.
Whatever the goal is, we can find a way to make that happen.
Make it work.
As long as it's physically possible.
Right.
And it's fun, but I don't get a whole lot of as much gratitude from them as much as I kind of thought I was going to get. Part of it, I think, because the investment for something like that is not small.
Right.
And to do it well, it takes a team. So I have to use a lab. The reason why most general dentists nearby can't really do the same thing that I do is because I'm not using the same lab that they are. I'm using a lab technician who might be out of state and can make restorations that look so real and beautiful that's a work of art.
Wow.
Whereas the more local labs can make things look real.
Right.
They look like teeth, but they might not look the same type as the restorations we give. I think because people spend that type of money, they expected what
Their
they got.
Their expectations are higher.
Whereas I also do, what's funny is I do sleep apnea treatment. So I treat people with snoring and sleep apnea. And I get more gratitude from those people than the veneers because I think the sleep apnea people don't really think it's going to work, but it's kind of a last ditch effort. And so what I give them actually works. I'll get letters from their spouse, the tears of joy. And so that's the part that you're like, I'm excited in the morning when I know my schedule is going to have this snoring patient coming in.
Because you could really change someone's life versus just make their teeth look better.
Exactly. Now, what's interesting, I love the stories of the Smile Makeover, and they're like, I got a job promotion because I'm increasing my sales when I sell cars.
Wow.
And it's because it's more of an indirect thing. They feel better about themselves. Their self-esteem improves. They have a little bit more confidence. So when they're selling that car or telling you, Mrs. Jones, they're just better at it.
Fascinating.
And it's not really me, but I had a part of it.
Right.
I got into it a little bit. So that part was fun. But yeah, the snoring and sleep apnea, we get great stories with those of how
It's fascinating how much there is that has to do with teeth than meets the eye. I mean, sleeping.
Yeah. If the jaw falls back and blocks your airway while you sleep, you're gonna make a noise. You're gonna snore. You might actually die in your sleep because you suffocated. And so that's the one thing that I do in my office that I tell people you need. Everything else is a choice.
Right.
If you have a broken tooth, we can pull it. You don't have to have that crown. But when it comes to oxygen, if you don't, you'll die. So yeah, the other part. The other thing that I do that is probably overlooked. I do a lot of Botox. And Botox is such that people are like, well, wait a minute. But the muscles that move the teeth to chew
right.
Are things that I'm very familiar with. And so knowing how to do, I'm pretty good at injections. I'm getting people numb all day. So using a needle to do the rest of that helps. Which also comes in, when we started doing the cosmetics, the smile makeovers, we would show people their picture before we started. What do you want different? And they started pointing out all these wrinkles. And you're like, I probably should have clarified teeth. But we thought, well, why not add Botox to it?
And that's how you got into Botox.
I actually got into it therapeutically first. People with headaches and clenching their teeth and sore jaw muscles. And we started seeing cosmetic side effects. And then when people started bringing it up, I'm like, well, I already do the Botox. Why? I should just offer it comprehensively instead of just
You already
focused.
have them in the chair.
They're in the chair. I've got it in the fridge right now, mixed up, ready to go. We might as well.
That's awesome. And it worked out. That's fascinating. So I'm curious, is being a dentist for everyone?
No.
Why not?
Like I've told my daughters are in college now. They're considering careers. And most people are like, oh, so you're going to follow your dad and be a dentist? And they don't even have to look at me. They're just like, no, not at all. It does take a certain personality to be a dentist. And I'm not saying like you need to be a leader, because that would be the practice owner. The associate dentist, quite often, many of those aren't much into leadership. Now, you can have strong personality, people that could be, or used to be. Like my brother used to be a practice owner, but now is an associate. So his personality isn't the typical associate. Truthfully, I think he's the best associate because he understands the practice owner's stresses and things that would be important, as opposed to, I want to do it this way, when it might not make a business standpoint, might not make any sense.
Interesting.
So I think you have to be someone who, number one, cares. You got to care about the patient, care about people, which can sometimes be very, very hard. In this day and age with social media, I like people less and less.
I hear that more and more.
So
I hear that from more and more people who sit in that seat.
Yeah.
But I think you know what? I think every person in the world who works with people, it's a human thing.
Yeah.
It's not that you don't like people, but it's
I do.
It's just an up and down thing, you know?
Yeah.
Humans are humans.
Yeah. And truthfully, quite often we'll hear people say, oh, I hate the dentist. Nothing against you, doc, but I hate the dentist.
Right.
And, we get that a lot, and I understand. Usually it's not so much they hate the dentist, they hate the procedure, they hate how it feels. We do a lot of things in our office to try our best to overcome their trigger. So we have, like when I give an injection, I have a computer that helps give the injection itself. So it's as painless as possible. I can't promise zero pain, but I'd say 90% of my patients say I didn't feel a thing.
I could tell, when you put some areas of mine to sleep, is that what you did with the, there's a sound that happens and you hold it there?
The computer is beeping while there's still a needle, it's still dispensing everything.
But when you do it, I feel nothing.
Yeah.
So I could personally, I can't talk for other people, but I personally, and I think I told you this on the chair too, I'm like, I didn't feel anything.
Yeah.
Like it was amazing. So there's...
So the advantage of modern dentistry is we can offer things like that. But as far as who should be a dentist or who shouldn't be, the very introverted person shouldn't be a dentist.
Because you're dealing with people.
Because you have to have the interaction with a person. And if you're introverted but interested in teeth, then you might be able to stay in the university and do research or something like that, where you don't have to deal with a patient. Because part of dentistry is to help educate a patient, because there has to be informed consent. They have to understand enough of their condition to choose the best choice for them, and the only person that can choose is them. So you have to be able to educate them to the situation, and then make financial arrangements to make it affordable. And sometimes the best decision is something that becomes less affordable, and we have to look for other options and be able to think on our feet of alternatives.
Interesting. So dentist phobia. You briefly mentioned that people are scared, and I forget the percentage, but I want to say I read it yesterday and I forgot the numbers, but there's a large percentage of Americans who are scared to go to the dentist.
Yeah.
Here's something I'm curious about. If a kid went to the dentist when they're 7 and they heard the drill, and ever since they're 7, in their head, you can't put a drill close to their teeth because it's just in their head, as many things from childhood happen. Where could and should that phobia be fixed? In the dentist office or at a therapist?
I would go even further back. It starts at home.
Okay.
I will say a lot of the anxiety, kids don't know that the dentist is scary, but if the mom and dad are saying, oh my God, we're going to the dentist, it's horrible, you're going to hate it, that kid is already showing up scared.
Huh.
Now, when you're talking age 2 or 3, they're scared of everybody. So that's different. But if you've encouraged this fear or this hatred towards the dentist, that's mom's fault.
Huh.
So the parents that say, aren't we lucky we get to go to the dentist, and do that at an early age, then we can encourage a positive experience at the beginning. Many times I'll see a child and I can tell that the experience isn't going to go well for the procedure that needs to be done.
Because they're freaking out before they even...
Yeah, and that the situation of that tooth is such that there's going to be some discomfort, even post-operatively. I don't want to create this phobia that's going to go all through adulthood. And so quite often that's when I make that referral to the pediatric dentist, who has more... I don't want to say more compassion, but more, the office is designed to create a good experience as much as possible. And quite often that also might mean that we have to put the child to sleep in a hospital setting so that we can get everything done without traumatizing the child and creating these anxieties. That alone could be scary as well. So, the best thing is prevention. Try not to get to that point. But if we're at that area, we might not have any other option than to do it that way.
As a dentist, what would be your best, if you could fix the world, what do you think the best or closest thing to a cure to cure this dental phobia of in people? Is there an idea that you have as a dentist, or is there just some people will be scared?
Yeah, I wish I knew. To be totally honest, well, because of that phobia, only 50% of the population even goes to the dentist, because the other half are too busy or scared, or both. So the people that we actually see in the dental office are the ones that are at least proactive to actually go.
To at least make an appointment and show up.
Exactly. 50% of the people, it's not a dental insurance thing. And dental insurance can be a different conversation because it doesn't really exist. It's just prepaid dental benefits. But with the dental benefits, half the people with them don't even go. So it's not necessarily a money thing. It's just... It's got to be something you prioritize in your life to make it a part of what you do.
Interesting.
And if you're already kind of scared, then that's less likely to happen.
One thing, talking about going to the dentist, one thing I personally found, and I don't know if people view it the same, I found that once I had some fillings to get done. Once my fillings were done, once I reached a point where, we're just down to maintenance, 2 or 3 times a year. Once I personally reached that point, it was like, every few months I go in for a quick cleaning and I'm done. And then the whole view of going to the dentist, for me at least personally, changed. So again, just a guess, maybe for people it's just getting over that hurdle of getting your teeth to a point where you just need maintenance.
Yeah. Many times with children, if they're scared, or we see that there's something going on that should be treated, doing treatment on a 4-year-old is a different story than a 6-year-old. There's so much development and change that happens that if it's something that if we can paint something on the teeth to kind of slow things down, knowing that it still needs to be done, we might be able to have enough positive experiences so that when they're 6, we can do maybe the negative thing, but we've built up a bank account of deposits of positive.
Interesting.
So that when we do a little bit of withdrawal, the positives outweigh that one. But if their very first experience was traumatic, it's not likely to keep going. Same with adults, where sometimes if there's been a period of time of, I don't want to say neglect, but not as proactive treatment, there might be a few things to do. And once we get everything done, the maintenance aspect, as long as we stay maintained, is fairly uneventful. It's straightforward and simple. It does require a schedule.
Right.
Some people we want to see them every 3 months, and some people we want to see them once or twice a year. And as long as we stay at that recommended interval, we might not have anything else going on. Decay nowadays is much different than it was 50 years ago.
Why?
I think the fluoridation of the water supply has had good and bad things happen, but the fluoridation in toothpastes and things, we're just not, the way that the bacteria works is different. In the past, we would have cavities that kind of if the decay would start, it kind of widened up as it went down. Now, when we do have decay, the enamel is so hard from the fluoridation that if there's a one little niche, one enamel rod for them to go down, they can get actually down into the tooth and it kind of explodes inside. So there's still dentistry to do. The decay will never go away,
right?
But the frequency is less. We're getting to a lot of lesions later than we could have had the hardness of the tooth not really been there.
Interesting.
So our approach to in dentistry is a little bit different than it used to be. It used to be if it was a big crater, that's when we'll jump in. If we see just a groove that's discolored, we used to say, well, let's wait, see how that goes. Now the groove right now it's let's open that up and let's clean that out before it gets really, really deep and mushroom cloud inside.
Huh. Interesting. Why is dentistry so expensive? Why is dealing with your teeth so expensive, or at least people view it that way? I think it is because it is the case.
Yeah.
Why are teeth so expensive? What is it about?
It's kind of all the different factors,
including your student loans.
The student loans are a factor. The employees all want more every quarter. They want to raise. So as everything goes up, it's kind of like a car. 40 years ago, you can buy a car, or 50 years ago, I'd buy a car for about $800. Now, if you want a decent car, you're looking at what, $20,000? It's just going to go up, and it's going to continue going up. It'll never go down. It might stay flat for a little while, but then it'll
go up.
The other thing that's been a real challenge is as the corporate dentistry has taken over and doing more, insurance in the state of Washington, at least, the insurance is changing reimbursements. So if everything was already costing us, because we have to pay the lab technician to make the crown, if they suddenly slash the fees by 40%, we're going to have to make up for it. Usually the brunt of that drop in compensation is going to then go passed on to the patient, so they'll have to pay the difference.
Interesting.
So the expense is because as things improve, we've got better materials that now they're more durable, they last longer, they're better, but they also cost more, so we're going to charge a little bit more. And what's sometimes hard to understand is things that we do now might cost more, but they actually last longer. So it used to be that we were doing fillings over and over again. It used to be that we would look at a tooth. If we did a filling on it, we're probably going to make a lot of money on that tooth during that tooth's lifespan. We start off with a small filling. A couple years later, we do a larger filling. A couple years after that, we need an even larger filling. A couple years after that, we have to now do a crown. A couple years after that, we have to do a root canal and a new crown.
Oh my
You might
God.
make $10,000 on that one tooth. Nowadays, we might recommend a treatment. It might be $1,000 to treat it right now, and it lasts for 20 years.
Interesting. So instead of 10,000 over 20 years, it's 1,000 over 4 visits.
So it seems more expensive right now because it's an upfront cost. But if you look at a long enough time span, it might actually be a lot cheaper.
Interesting. So it's the whole bigger picture.
Yeah.
I do want to ask you how the industry has changed since you started.
Uh-huh.
But before that, I'm just curious. So the way I view taking care of my teeth from my end, aside of foods I eat or don't eat, flossing and brushing my teeth.
Okay. Those are both good.
Both good.
Yeah.
But as a dentist, from your perspective, if one had to go, which would you keep around? Flossing or brushing my teeth? Which keep my teeth healthier?
It would have to be strategically done.
Okay.
Because I would say get rid of the toothbrush and keep the floss. Only if your diet was such that you're eating foods that had a natural cleansing aspect. Like eating an apple, the flesh of the apple actually does a pretty decent job of brushing or debriding the debris that's on the teeth. But if you weren't eating a lot of apples and you're eating a bunch of cakes and soft things that are sticky and things, maybe lose the floss.
And brush the teeth.
So I think it comes down to if you were strategically eliminating one, you could do other things that
Interesting.
that would help.
Wow. Well, that answers that question. Cool. Since you graduated dental school, 20 years, how did the industry change? I know it has.
From a business standpoint or from the physical doing the teeth part?
Both.
Okay.
How do you view it from the day after you graduated to today sitting here? What are some things that took place that you're like, wow?
Well, looking at a bigger picture, we're living longer, And so as the dental technology has improved, we're keeping our teeth longer as well. So if you look back with 1901, the average lifespan, I want to say, was right around age 48.
Oh.
So people were dying younger. Now, there were people that were living longer than that, but there were quite a few others that weren't.
Right.
So the goal was pretty much what to do to get you to that age. And it wasn't that unusual to expect to lose your teeth. You know, there's an old phrase that I said to somebody recently, and they looked at me and go, "What's that mean?" And I said, "Oh, looking long in the tooth." Well, looking long in the tooth is because would mean you're getting older. Because periodontal disease is when you lose bone, and so your teeth, the gums recede, so your teeth look longer than they were. You don't get that look at age 20, but you might have it at age 50.
Got it.
So looking long in the tooth is an expression saying you're old.
Gotcha.
I had a friend that grew up in the East Coast, and he said that there was a term called the banger bride, banger main. It was very common as a wedding gift. And weddings were going to be around age 20, 25. A wedding gift was pull all your teeth and get dentures. So by age 20, we were already edentulous, and now you're it's a lifetime of denture maintenance. So we don't do that anymore.
Right.
So people are keeping their teeth, and it was more common maybe in the 50s and 60s, where eventually by age 50 or 60, you were having your teeth pulled and doing dentures at that point. Dentures were viewed as an old person situation and not a young person situation. Dentures now are less common. Full, complete dentures where you're losing all of your teeth. It's not that unusual to lose a tooth here or a tooth there, and have to have partial denture or bridge work and things like that. But because people are living a lot longer, we've had an increase in periodontal therapy and periodontists, the specialty that deals with the bone and gums, the teeth, the structures that support teeth. So they were less or didn't exist, many, many years ago. But now that we can maintain the teeth, now that's a specialty that we have. And very soon there's talks of having geriatrics as a specialty. We've got pediatrics, maybe have geriatrics as a specialty as well.
So it sounds like the work a dentist performs in someone's mouth changed dramatically.
Well, and then the other thing that came out, in 1955, Brannemark, a Swedish gentleman, figured out how to do implants, dental implants. A lot of the knee prosthetics and the hip replacements and knee replacements, that came from dentistry originally in dental implants. And he was doing some research on some screws or the materials that put into a rabbit's leg. And after research, you destroy the rabbit. And research, you don't have a lot of money to pay for things, so you always reuse things. So he went to go reuse these posts, and the titanium one wouldn't come out of the bone, while the others he was able to just take them back out.
Interesting.
That's how he learned what's called osseointegration. And so dental implants were born. Well, it's been great for replacing those missing teeth. You lose one, you don't have to do a denture or a bridge, you could do an implant. If you lose all of them, we can actually have, instead of just being stuck with dentures, we now have dental implants that can either secure it, you screw the denture into the implants and it never comes out, or you can have something where it snaps into those implants. So as the implants have been able to help the people that are losing teeth, it's opened up a world of other opportunities.
Wow. As someone who sees patients all day, what's a thing or two things that people come into you because that if they would just take care of that at home, they wouldn't even be there? What's a simple thing people could do about their teeth that you see most people don't?
Probably the simplest thing is just the brushing and flossing, getting the cavities or the inflamed gums. Because if you have inflamed gums, that inflammation is going to start breaking down the bone, and then the gums will recede, and you'll have less bone to support the teeth, and that's how they would then fall out. Now, you can have a patient who does absolutely everything right. There's no replacement for coming to the dentist. We had not long ago, we had a patient where she, for whatever reason, whether it was a choice or not, she didn't come to the dentist for about 5 years. And in her mind, she figured, well, as long as I brush and floss religiously and do everything perfectly, I won't have any problems. And it's not entirely true, because so when we got there, she had a periodontal situation, a inflamed gum situation that was going to require just a little bit more effort on our part, a little bit more effort on her part to come to see us a little bit more frequently. We want to see her every 3 months instead of every 6. And she'll always have the types of bacteria that do that will never be gone. We can never cure periodontal disease, but we can maintain it and we can prevent it from getting any worse but it's going to take some effort on everybody's part. And there's really no replacement for having us go in and do what we do. But simple brushing and flossing goes a very long way.
A long way.
Yeah.
And that's aside of someone looking at their diet and the foods they actually put in their mouth.
Exactly. The diet is a factor as well. You know, they used to say, well, I don't eat any sugar. That was the other thing she did say. I don't even eat sugar. Well, there's sugar everywhere. Eat natural sugars and things like that. That apple, very high glycemic index. So there's sugar everywhere, but it's what we are concerned about is fermentable carbohydrates. So milk is that's why baby bottle caries is such a big thing. Many people put their child to bed with a baby bottle full of milk, and that milk will feed the bacteria that because the cavity isn't from the sugar. The cavity is from the bacteria in your mouth that feed on the sugar, and then the byproduct is acid. They secrete acid as a byproduct of consuming that sugar. That acid is what breaks down the tooth structure. So that's why if someone was in having cancer treatment and they had decreased salivary flow, our saliva keeps the pH, the acidity of our mouth at a neutral thing. If we don't have the salivary flow, we have a very dry mouth, then the entire mouth is acid. And so instead of having one little spot on a tooth that turns into a cavity, the entire tooth might start breaking down because of that. So there are things that many oncologists are very good nowadays about saying, go see your dentist. We can actually make trays for you to wear and put fluoride and other products in there to kind of keep the teeth healthy during the cancer treatment and things.
So. Interesting. So, so brushing and flossing too, if someone could do that.
It goes a long way.
It goes a long way. Yeah. Goes a long way. Doc, what are some job misconceptions that you found to be true for someone out there who might be considering this, being you in 20 years and getting into maybe owning a practice or working with people or just being a dentist in general? What are some misconceptions that you found to be true after starting?
Misconception probably would be something like you just got to show up. You know, you're not just clocking in and then you just do the work and go home. Especially if you're a practice owner, it never leaves you. It's 24/7 because even if you're not there on site, you're thinking of things to improve about the practice, or you've got some other deadline, you've got quarterly taxes, you've got something else. There's something always happening.
You might be open 3-4 days a week, but you're a practice owner 7 days a week.
7 days a week, yeah. Which might dissuade people from being a practice owner and say, okay, I want to be that associate dentist. I had a friend right after dental school, we were talking about life, and he had been a practice owner for a year and then sold out and moved to a different city. So I was taking a class and I was meeting up with him for lunch, and he goes, I love it. I don't even know my phone number and I don't even have a key to the front door. And I just show up when I'm told to and collect my paycheck.
Loves that.
And he loves that. So that is an opportunity within dentistry that you could do. It's not for everyone, but worked great for him.
Interesting. Necessary skills, if you could throw some out there. What are some vital things, if someone does want to become a dentist, they are going to become a dentist, what are some things people should think about because you really need that as a dentist that might not be that straightforward?
There's two things that I think are absolutely important. Attention to detail.
Okay.
You have to be very detail oriented. There's definite cookie cutter steps. When I do a filling, that I have to make sure it's clean. The preparation of the tooth has to be a certain shape. Then once the shape is correct, I have to clean it and disinfect the tooth to then put the right material on there to get things to stick, and the right material then to fill. And then once it's done, I have to be able to shape it to look like a tooth. You have to do it in the right order. You have to do it with I have a timer in the operatory. To one step might be 12 seconds. 15 is not good. 12, it's got to be 12. So I did work in an office. I helped a guy once, and they didn't have timers anywhere. And I said, well, how do you know? Well, you kind of count in your head. Like, no. Certain materials, when you take an impression of your teeth, it sets in 30 seconds or 60 seconds or 3 minutes. I said, well, what about those? Well, you can kind of touch it. When it feels firm, it's done.
Oh, man.
No, there's still chemical reactions happening. If it's 3 minutes, it's 3 minutes. And I think that's what also separates the adequate dentist from the better dentist.
Interesting.
So attention to detail is very, very important. Follow the protocols. But another is take some courses on talking to people, interpersonal relationships. For lack of a better description, a sales course. Because the sales courses aren't going to teach you how to trick people into doing things. It's going to help you communicate better. to find out, because the best thing I do, I never tell people what they need. My least favorite patient is the one that says, "Doc, just tell me what I need and I'll do it." So I'll probably tell you, you don't need anything. It's all about, well, what do you want?
Preference.
So based on your wants, you would need to do this first, or this, and this. So if you can tell me your want, I can tell the need. But if you just say, well, what do I need? I don't know.
Got it, because you don't know what they want.
So you have to have that, be able to have that communication, that conversation. And if you're not comfortable with that, then there are classes that dentists can take to learn how to be better communicators.
And they don't teach you that?
That's not in dental school either.
In dental school?
No. Well, they kind of, no.
Do you think in dental school they should spend more time on buying a practice or no?
Yes, but then at least in my dental school, there's so much that's already, we'd have to say, okay, what are we going to cut out to make room for that?
Really? There's so much to cover.
Oh, it's ridiculous. The typical course load, like in college, a normal load is 15 credit hours per term. Dental school, the equivalent would be about 22 hours. So we're doing more, and mostly, usually when people say I got a full load at 15 hours, that's a pretty full load. There's so much reading, there's so much homework, there's so many projects. So do another 30% more, and that's what dental school is every term. Wow. So what would be cut out to do that? I'm sure I could, if I looked at my old curriculum,
you could find something.
Well, we didn't need that, and that was stupid. I'm sure there are things that could be, but I think that's where I think the dental schools would benefit from having prerequisites, not just the sciences, but also have at least an introduction to business and at least a communication class. Make sure you know how to talk. Because
you're dealing with people.
Yeah, because we had to deal with people.
I had a mechanic on, and we were talking about, I think mechanics fix cars, which they do.
Right.
But I realized talking to him, the cars are this small percentage of, he owns a shop, he has clients. How do you bring people in the door? How do you keep them in the door? He deals with people.
Yeah.
He fixes their cars, but he's really working with people.
Yeah.
The veterinarian, no different. He deals with animals, basically. Pet's owner who's like doing that.
Right.
So there's so much to it. I totally get that. We don't have a lot of time left. There's so many things we probably didn't cover, but let's real quickly talk about recurring training. Staying on top of things. You mentioned dental school is 8 years. From what you told me, just talking to you in the office here and there's so much to stay on top of things and you have to keep going. It sounds like really dental school is 30 years because you're constantly learning.
It's supposed to be a springboard to teach you how to learn and continue on. Unfortunately, not every dentist does that. They do have the right to just have their license and just that's it.
Wow.
When I bought the practice from the guy I bought from, he was very proud of the fact that he didn't do any continuing education after dental school. Not a thing. So basically everything he was doing day to day was what he learned 30 years ago. Well, that's terrible dentistry in my mind. Right. So I had a lot to fix. And a few years ago, the state of Washington did change that we have a minimum number of continuing education hours we had to do. The problem is that what qualifies as continuing education still would allow my previous owner to still get by with not doing any continuing education. So from a consumer, it would be very difficult to know, did your dentist stay up to date? Is he taking continuing education? Or is he like my previous owner who was pretty lazy with the CE?
And it sounds like the problem with that is that from a client's point of view, you can't tell.
You wouldn't know.
That's a problem.
That's a very big problem. Kind of like many people say, well, I want a new smile. I can just go to any dentist. A dentist is a dentist is a dentist. And to get us, I would say about 20% of our smile makeovers, I'm remaking other dentists' attempt to do a smile makeover.
Wow.
And so it is challenging for a consumer to be able to do the right research to figure out who is the best choice for them. I think if you're just trying to get your teeth cleaned, most dental offices are probably going to be pretty capable. But even having said that, I had someone come in, they've been going to the dentist every 6 months, and we took the x-rays, and I had to pull 5 teeth because there was so much bone loss and destruction and problems, and he had no idea. So even minor things like clean your teeth doesn't always mean everything's fine.
Interesting. So, wow. So you're constantly.
I made a commitment early on. I graduated with an inferiority complex from dental school. I just felt like I was married before I started dental school.
Right.
And I realized that if I was going to stay married, I couldn't devote as much attention to my studies as I had to get in. And As such, I don't know what my class rank was. The people at the top of the class, they all know who each other are because they're all competing to be number one and then go into specialty service training and things like that. I just didn't care. I didn't want to be a specialist. So I just figured as long as I graduated, I must know how to be a dentist. However, I graduated thinking, do I really know how to be a dentist? So I started taking a lot of continuing education courses, learning how to do this, that, and the other. I think I leapfrogged most of my class and am a better dentist because of it. Because of my commitment to the continuing education, I only do the courses if I think my patients are going to benefit from it. So I'm not just going to take a course that doesn't really help them. Kind of like when I buy the technology, I've got that computer to give you the shot. I don't do that just because it's a fun toy. I want your patient experience to be better. And so I think it would be a challenge to find out which dentist is like that. And it's a challenge on our part for us to communicate to people that that's what we do.
Yeah, but from a dentist point of view, if someone wants to become a dentist, continual education is a huge...
You should be prepared to continue your education journey past the graduation. That should be something that you plan to do. And there are different levels. You don't have to do as extreme types of training that I've done. There are other things a little bit more basic, a little bit more routine that can be done.
Doc, what's some advice you'd give to newcomers, new dentists coming up behind you? What are some things you wish you would hear or did hear when you started out?
So as a new dentist, I'm assuming that they're graduated, they are a dentist now. I think the best thing to do is find a mentor. I think most of us naturally want to give back. We didn't get here on our own. We had other people that helped us, gave advice and things like that. Find someone who can be a mentor, teach you what they learned. They're not going to know everything, but what they know, they're going to know. And it takes a little bit of homework to find the right mentor. Had I chosen the guy I bought my practice from to be my mentor, I just would have been as bad as him. So you do have to do some soul searching and find out what it is you want and find a mentor that can help you achieve that type of a goal. And then and learn from them. I do think there are some benefits. I probably jumped in too quick to practice ownership. I probably would have benefited from being an associate for a little while, learning, maybe working in a couple different offices to see the different styles of office that I like this, I don't like that. Maybe learn some business things. I ended up having to hire a business consultant to come in and teach me how to run a business because I didn't know what the hell I was doing.
Right. You knew teeth, but...
I kind of knew teeth, kind of. So remember, I had to leapfrog people. I don't know how good I was.
That's awesome. Last question, Doc.
Yeah.
If there was one thing about your industry that you could change, what would it be? One thing, not two. I know you changed 10 things.
Yeah. Probably the insurance dependence. Many people make their decisions based on, does my insurance cover this? And quite often, just because the insurance doesn't have a benefit for it, doesn't mean that's not the right thing for you. They've suppressed the revenue. I mean, dental insurance way back in 1960 when it first started was about $1,000 per year. Fast forward 60 years, it's $1,000 per year. Had dental insurance kept up with inflation, we'd be looking at about an $8,000 or $9,000 a year benefit to be spending to maintain. We can fix a lot of things with that amount of money.
Wow.
Because they never went up in
Why did they not go up?
Because they could. So at one point, early on, they did increase the benefit, and then they said, why do we do that? They went back down, and no dentist complained. Because $1,000 back then still covered quite a bit.
Right.
And I think had there been an outcry saying, no, we need to at least keep up with inflation or something, I think they would have increased and done better. But it's just the nature of the benefits. Many times there's actual exclusions for treatment that really should be done. The person would benefit from, but they just don't want, the insurance just doesn't want to cover it. And it has nothing to do with a benefit for the patient or is it good. It's just something dental insurance is only out there to exist to make money. And so if they know this other thing, which is great treatment and beneficial, but they're going to lose money on it, then they just don't cover it.
Interesting. You would change that.
I would change that. I mean, honestly, if it's hard to say if insurance just went away completely, so the patients would look into it on their own and budget for it. I mean, people have a budget. I was going to say, well, I have a haircut budget, but I don't think you do. But people have certain things they've budgeted for. There's going to be a clothing budget and a beauty budget. When I started doing Botox, I learned people had a hair budget at the time, and I said, well, you just need to figure out your Botox budget. How often do you want to come in? Then you just budget for that. And I think healthcare is something that people just need to have, because if we can maintain it's very affordable to just keep your teeth. If you brush and floss and do the right thing, it's not going to cost a whole lot to fix things. It's when people aren't doing anything at all and when things fall apart that it can be and it's very cost prohibitive. The insurance doesn't help. If I'm reconstructing an entire dentition, insurance isn't helping at all anyway. And so I really don't want them to really be a factor in the decision process anyway.
Interesting.
So if there was less dependence, if not a full elimination, but just less dependence on an insurance company that's not looking out for your best interest and doesn't really care about you, then I think we'd be on the path of a better situation.
I like that. So obviously we'll have the information in the description, how to get a hold of you. But for anyone watching out there, even in Orange County or from Belgium in a beauty contest or anyone who wants to, is there a place that people could go to and
well, the easiest thing to find information on me is my website.
Okay.
It's drtimmerman.com.
Okay.
I have a podcast that does give advice. It's partly for dentists, and we always have at least one question that comes from a non-dentist.
Okay.
It tends to be the more obscure questions and a little bit unfiltered. Okay. So people, it's not safe for work to listen to.
Adults only.
Pretty much.
Okay.
It's called Working Interferences. Okay. Is a podcast. So you can go to iTunes or anywhere that you do look at a podcast.
Okay.
I have a partner. He's in San Antonio. The two of us record once a week, and we answer 3 questions. So working interference is a dental term. So a dentist will understand working interferences. The lay public wouldn't know what that meant.
I don't get it.
It's a bite thing. So if you were chewing food and there was a spot that shouldn't be hit, that's an interference. So since you're chewing, it's a working interference.
Gotcha.
So we can, and that's usually we go, we adjust the bite. So you get a brand new crown. Sometimes the bite needs to be adjusted. There might be a working interference on that.
Got it. So it's dental.
So Josh and I are both working interferences.
Cool. So you got the drtimmerman.com and then the Working Interference podcast.
Yeah.
Cool. And then we'll have stuff in the description below. Okay. And did you have fun, Doc?
That was great. I love this.
Cool. Awesome. Thanks for coming.
All right.
I learned a lot. Awesome.